Hello, I am Robert Weldon. I shall be your student nurse today, and I shall be administering your IMs and your SQ injections, which is intramuscular and sub-Q. For your purposes, I'm going to provide privacy. Now I shall wash my hands for you. Now, will you please state your name and date of birth? Yes, that is correct. Do you have any allergies? No, that is wonderful. Thank you. So, now, for demonstration purposes, I am going to locate with my partner here, and I shall demonstrate where the intramuscular injection shall go. The first one shall be right here in the deltoid. I shall put my hand on the acromial process, fold down, and inject. For the next one, will you please lift your leg for me, ma'am? I shall find the greater trochanter. You're good. And then I shall go from here to the patella, go in between, and inject. And that is the vastus lateralis. Now for the ventrogluteal, I shall lift your leg, find the greater trochanter again, and then I shall inject, trying to avoid the iliac crest right there. And that is the ventrogluteal. For the dorsogluteal, will you bend your leg one more time for me? Find the greater trochanter again, thank you. Find the ischial spine, go in between, and I will inject, avoiding any other bones. For sub-Q, there are 4 locations, and the first ones are 2 inches away from the umbilicus. You have the upper quadrants and the lower quadrants. You have the adipose tissue in the thigh. You would pinch it and you would inject. If you would please turn for me. Thank you. The next 3 shall be in the back of the arms, the posterior, underneath the scapulas in the upper back, and then in the lower back where the love handles would be. Thank you. You are wonderful. For the gauges of the needles, for intramuscular, I shall use 20 to 23, but for the deltoid, it would be 23 to 25, and it would be 1 to 1/2 inch needle. For sub-Q, I would be using a 25 to 27 gauge, as well as a 1/2 inch to a 5/8 length needle. So for my procedure, I will gather my supplies, which I have a 1 to 3 milliliter syringe for each, the sub-Q and the intradermal. And then for the intradermal, I have a 23 gauge to 1 inch, which is in range. For the sub-Q, I have a filter straw, because I am using an ampule, and a 25 gauge 5/8 needle. Now I shall get these ready as I make sure with the MAR. For the intramuscular, I shall be administering 1 milliliter from a vial and then I will throw this away. And the cap, because I really don't care about the cap. Now I'm going to prepare the sub-Q. Get rid of the cap. And then since I'm using an ampule, I'll wait before I apply this, that way I keep it sterile. For the intramuscular, I shall break the cap, this way I can move it around, and I shall get 1 milliliter of air to put into the vial. Now I shall take the vial, and since this is an unused vial, I would not clean it, but for demonstration purposes I am going to anyways, because if it has been used, I would clean it to make sure it was good. I would loosen the cap, then inject the air, turn it upside down, and I will get 1 milliliter of the solution, making sure there are no air bubbles. Actually, I still need a little bit more. There, we are at 1 milliliter. Now I shall safely recap this for later. And there is that needle. Move that over to the side. Now for the ampule, I'm going to now get my filter straw and making sure not to break sterility, because I shall be putting the filter straw into there. Apply the filter straw. Now with the ampule, I shall take it, make sure there is no solution at the top of the neck. If there was, I would wring it to get it down, which there is none now. Take an alcohol wipe and break it away from me, and then throw this in the sharps container. Now I shall take the filter straw, and I shall be getting 0.5 milliliters, which for an ampule, I do not have to aspirate at all. And I can take it, since this is the first time, I can turn it upside down. And I shall break it and get 1.5 or half. Making sure there are no air bubbles. Okay, and then I shall take this, undo the filter straw. I shall be throwing that away, applying a needle cap, which is a 25 gauge, and applying that, and I shall be using that for demonstration purposes later. And then I shall throw the ampule away. At this time, I would apply gloves. Clean gloves, because this is not a sterile procedure. Oh, I missed a finger. There we go. Now, I shall make sure to locate my site. Let me get my needles over here ready. I shall locate my site, and first I shall do the intramuscular. So I shall do the left ventrogluteal. I shall take it, find it, wipe, keep my non-dominant hand there, so I know. Oh, I'm gonna have to leave though, because I should have loosened the cap on these. Loosen the cap there, loosen the cap there. Now I shall go back, re-find it, reposition, making sure to keep my hand there. And for intramuscular, I shall go in at a 90-degree angle, spreading it in a daring motion. And then I shall take it, and for demonstration purposes, I am not going to inject the medication, but I will push down anyways. I push down, it is injected. I shall remove, apply pressure, and dispose into the sharps container. Now if the patient needed it, I would apply a Band-Aid for the patient. The patient does not need it. For sub-Q, I shall now find the position, find the back of the arm, and I shall take the needle. I will pinch the skin up. Now with sub-Q, I can go at a 45-degree angle or a 90-degree angle. I'm going to go ahead and go at a 90-degree angle, apply. Now for demonstration purposes, I am not going to press down on the injection, but I will. I just injected, pull out, and apply pressure. Dispose of in the sharps container. Again, if the patient needed it, I would apply a Band-Aid. Now both times I did not recap the needles, but I shall dispose of these into the sharps container as well. Now I shall document on the MAR of where I injected. I injected into the left ventrogluteal for intramuscular, 1 milliliter with my initials. For the sub-Q, I injected into the left posterior arm, 0.5 milliliters with my initials. My signature, student nurse, initials. Thank you. You have a one. Actually, my bad. I forgot to dispose of my gloves. I should have done that before I did this. And I would throw all of that away. Hand hygiene. Now you have a wonderful day.